Well, people often ask, why hasn't cancer been cured yet? It's in the academic, it's not because of the science. It's not because the scientists don't know what to do. It's because there's too many other reasons to do research. And
I'm joined by Bill Andrews, founder and CEO of Sierra Sciences. Bill is a molecular geneticist who has played key roles in the development of breakthrough therapies across cancer, cardiovascular disease, and aging, most notably in the discovery and application of telomerase. His work sits at the intersection of evolution, genetics, and human longevity, and he spent decades asking not just what causes aging, but why it exists and how we might intervene. Today, we're going to explore the science, the controversy, and the real constraints behind extending human health span. Bill, welcome to Inside Pharma Leadership.
thank you for having me.
Well, thank you. So here's a first question. Tell us a little bit about your background and how you ended up starting Sierra Life Sciences.
Sierra Sciences is the name of the company.
Sierra Sciences.
My background's quite lengthy. I have been obsessed with human health my entire life, especially the subject of aging. And I mean, essentially all through college and graduate school and everything like that, I've been just obsessed with taking every class that I can to really learn how to do something about all the health problems that humans have. So I've been interested in aging, but trying to figure out all the twos and twos of aging was a real struggle. And so when I got my PhD, I actually went into biotech first and focused on cancer, heart disease, inflammation, all kinds of things, because I still had to do a lot of deep thinking about what's going on with aging. But during the time in the biotech companies, I actually ended up playing a key role in discovering a lot of different cures for diseases. I mean, I'm one of the inventors of Human Growth Hormone, tissue plasminogen activator for breaking up blood clots when somebody has a heart attack, erythropoietin, which is a drug for stimulating red blood cells synthesis for people that are anemic. It's also the drug that Lance Armstrong used to cheat. The beta seron, the very first drug for multiple sclerosis. I've been like obsessed with the idea that I want to cure diseases. I mean, I gauge my success by how many diseases I can cure, not by how many publications I can get or how much money I make. It's like all that matters to me is getting the diseases cured. But in terms of, I was on cancer research. I've actually invented like 6 different cancer drugs that are in clinical studies. One just got approved called Rytelo, Rytelo. And it is the reason why I've had such a great career is because I don't focus on like gauging my success on the number of publications I get.
Okay.
As soon as I get done with something, get it discovered, and all the people I'm working with want to publish, I say, "Well, you go publish. I want to work on the next one." That's why you'll find me as middle author on most of my papers, is because I refuse to help with publishing just to say, "Hey, look what I did." It's like I'm not done. I'm far from done with my research. But so in the subject of aging, I was always the reason why I didn't work on that immediately, even though that's been my prime interest, is because I'm trying to figure out the what and the why and the how not of aging. There were too many mysteries that didn't make sense. I always say all the twos and twos have to add up, and all the theories on why we age just didn't make sense because they didn't explain everything. And I don't want to go into all that explanation, but I kind of concluded because I was familiar with what's called the Hayflick limit, something that
Okay.
Leonard Hayflick discovered in the late 1950s and published in 1961, that human cells can only divide a certain number of times. That's really important. I mean, let that sink in for a second. If human cells can only divide a certain number of times and our bodies repair damage, like when you get a sunburn,
Mhm.
your skin gets healed by cell division. So as the cells divide, they lose the number of times they can divide further. So something is controlling the number of times our human cells can divide, and that puts a limit on our health span and our lifespan. Okay.
One of the things I found fascinating in doing some of the research is that limit of 125 years. Part of me was thinking to myself, well, I'm not quite halfway there. And then the other part of it, because you said, well, we don't have any humans that have lived 125 years. So part of me is like, I don't really have that much time. So it does make you pause and think about that.
Well, and in the cases where people have come close to 125 years, it's now been shown that those were actually fraudulent.
Okay.
but getting back to the thing was that because of this Hayflick limit, I realized that has to be a major cause of aging because we have to figure out the Hayflick limit if we're ever going to do anything to cure aging. Aging is never going to be cured unless we solve this Hayflick limit problem. But in college, I remember my anti-aging clubs in college, we would sit around thinking, how could a cell know how many times it has divided and how many more times it can divide because cells don't have brains. The best analogy that we came up with was that there has to be something inside of cells that's like ride tickets at an amusement park. I know that sounds silly, but that's the best analogy we ever came up with. That every time a cell divides, it loses a ticket. And when it loses the last ticket, cells can no longer divide and you die of old age. And
Hmm.
so when I was getting my PhD, I still couldn't figure out where inside of these cells are these ride tickets. And so that's why I went and did all these other things. But then in the early 1990s, I was at a conference on aging and I heard somebody talk about the fact that telomeres shorten every time a cell divides. And the telomeres are found at the tips of our chromosomes. They're like the caps on your shoelaces, except they're the caps on your chromosomes,
Okay.
and they get shorter every time a cell divides. And this guy was saying that he could measure the length of the telomeres and tell you how old you are and how long it'll be before you die of old age. And I'm realizing, oh my God, here's those ride
Mm.
tickets.
Huh.
And so I stopped everything I was doing. I was National Inventor of the Year for my cancer research. So I was big into cancer, heart disease, inflammation. I stopped everything, jumped ship, and went to work with this guy, Geron Corporation, to figure out how to solve this telomere shortening problem. And we made a lot of success. We ended up discovering this enzyme telomerase. And the way we discovered it was realizing that if every time human cells divided, if human cells actually could only divide a certain number of times, how could we possibly reproduce? How could we have children when our cells can only divide a certain number of times? So we decided there had to be something in our reproductive cells that prevented this Hayflick limit. And sure enough, our reproductive cells did not have a Hayflick limit. And we discovered that it's because our reproductive cells produce this enzyme called telomerase that essentially adds more ride tickets back to the ends of the chromosomes every time the cell divides. So,
Now, quick question: is there a way to predict how many times that a telomerase will divide? Is there like a
yeah,
predictive number?
yeah. I mean, it's like it is so well. I mean, a lot of people still call this a theory, but anybody who actually works with human cells in petri dishes and does research at a company like mine knows that whenever they go to a vendor to buy new cells, they have to, the vendor in the catalogs, they'll say, how old was the donor and how many times have these cells divided since being obtained from the donor? Okay, there'll be those two columns. And so you find, I mean, so you can calculate how many times the cells will divide after you get them from the numbers that are in the catalog. And the more number of times they will divide, the more you have to pay for them. But it is absolute science now. Okay, so it, you can buy cells. You can ask the vendor how many more times can these cells divide. They can tell you. You can calculate it yourself from the catalog. And then when you get the cells, yes, that's the number of times that they will divide. And
Okay.
so the more number of times it'll divide, the more you pay for them. But so we can predict that. In fact, we can take blood from people, not just in vitro and petri dishes. We can take blood from people, measure the length of their telomeres, and that will tell us how many ride tickets they have left.
Hmm.
And we can tell you how many more times they can divide and how long it'll be before you die of old age.
Okay.
And the problem is because we're only able to really measure it in human blood, that only tells us how old somebody will be before they die of old age due to something involving the blood. But if you have like some disease like muscular dystrophy, or you're an alcoholic and you drink a lot of alcohol and kill liver cells, the telomeres in your liver or your muscles are going to shorten so fast they're going to kill you before your blood telomeres would ever cause you to die of old age. So
Okay.
it doesn't tell you exactly how long it'll be before you die of old age, but in vitro, cells in
Yeah.
the future, we can calculate that. We know almost to the day when those cells will stop.
Okay.
And
Now, question for you, Bill. So earlier you made a comment in regards to studies. As we know, physicians, being published is something that's very important. And there's a correlation between that and getting in the way of actually being able to cure disease. Can you talk a little bit more about that and kind of that relationship?
well, people often ask, why hasn't cancer been cured yet? It's in the academic, it's not because of the science. It's not because the scientists don't know what to do. It's because there's too many other reasons to do research. And so scientists, and this is a very frustrating thing for me in my entire career. Scientists gauge their success by the number of publications they get. And then the more publications they get, the easier it is to get grants because the way to get grants to do research is from the number of publications you have. The more publications, the easier it is to get grants. So it's called publish or perish. So that's somebody gets a grant. The number first thing they do is say, okay, how many publications can we get out of this grant? And that's the focus. It is not on curing diseases. They do not, in academic research, scientists do not gauge their success on the number of diseases they've cured. This is where I've always been the exception. I've been People have not liked working with me in academia because I refuse to stop and write the papers because they take you away from the lab forever. Then when you submit the paper for publication, reviewers that review the papers just by nature are going to tell you, you got to do more experiments. You got to do this and you got to do that. You go back to the lab bench and do experiments just to get the paper published. All this is wasting time when you could be working on some kind of cure. And so that's the real big problem. That's why the academic world has not cured cancer, heart disease, inflammation, Alzheimer's, Parkinson's, all these other diseases. Okay, so
Okay.
in the commercial world, so I decided when I got my PhD, there was no way I was going to stay in the academic world. So I went into commercial, started working at biotech companies. But again, I found out that biotech companies are completely under control of the investors. Okay. I didn't know this when I was first at biotech companies, but my bosses who started the companies and created the companies, they were completely under control of the investors because the investors owned a majority of the company. The investors would own 90%, and the investors were in control. And then so projects were decided whether we continue or stop or do more research or what depending on what the investors said. Okay, and the investors, they gauge their success on how quick return on investment they get, how much money they get from quick return on investments. And then their number one goal is to make money. As soon as the company adds value, they sell the company, including all the intellectual property. And the founders, they can't continue their research anymore because their non-compete contracts and stuff like that prevent them from doing any more work in that field that they've been working in their whole lives. And it's just so again, the gauge of success in biotech is how much money do the investors make and how fast do they make it? And then the other thing is even these celebrity billionaires that have started these companies, they don't know very much about the science. They hire the celebrity advisors. And then the celebrity advisors hire the celebrity scientists. And the celebrity scientists, they don't really know what they're doing. They're just really good at getting on the news and talking and stuff like that. And then as a result, from these celebrity biotech companies, nothing gets accomplished. Okay, except for these very ridiculous repeating of studies that everybody already knew all along. I mean, they publish papers where all the really good scientists, they already knew the results of these studies. They just didn't think it was worth publishing it. They just wanted to move on and get things, but they can't find the funding to do it. So it's just the system's broken. Okay. And
So
so
I guess a couple of questions related to that. So I guess as a founder, how have you managed to work your way around that would be the first question. And then the follow-up question to that is how have you managed to raise funds if your goal has been not to basically do that because you want to focus on curing disease?
Well, I had a tremendous struggles. When I first decided to start Sierra Sciences, I had no problems finding investors. Before I got my first investor, I was 100% owner of this company, and uh, after I got investors, I found was that uh, several of the investors would completely take control and take over my scientific strategy meetings, start telling the scientists to start doing other things. We'll get back to curing aging later. But first, we got to add value to the company. We got to bring in some funding because we don't want to be funding all of this out of our own pockets and stuff like that. That's what they'd say. So we would do all this stuff and we'd get successful and then add value to the company. Then I was surprised one time I was giving I had 50 plus investors. Okay. And it raised $33 million from investment funding. And so I was giving a report to the investors, very exciting how we succeeded at everything. And then the head investor got up and said, okay, well, we've added so much value to the company. We should sell the company and think of all the profits we'll make. And I was devastated. And the investors didn't understand why I was because they were telling me, look at all the money you're going to make when we sell this company. And I was never in it for the money. And I wanted to cure a disease. I want to cure aging. So I fortunately had two of those investors that were also very interested in curing aging. They orchestrated a complete takeover. I mean, it
Mm.
cost me everything I had. So I ended up completely taking over the company. The investors did make money, okay, but it came out of my pocket and the pockets of those two other investors. And then those two other investors ended up selling me all their shares for a dollar each. Okay. So I became 100% owner. I still work with those investors, but they're not investors anymore. They just want a cure for their aging. So I'm now back to 100% ownership of the owner of the company, but I don't know anybody that had such a stroke of luck like I did. Okay. And so now I don't accept traditional investors anymore. Okay.
Yeah.
And including the well-known billionaire investors. I've had them all here. I'm right across the street from the airport. They'll park their 77s right across the street, walk across the street, come here, meet with me, make ridiculous offers to invest. And I turn them down. And they're always really shocked because I point out that they're only interested, as soon as they say, how long until I get a return on my investment? That's a red flag to me. I mean, aren't you interested in curing aging? Isn't the return on an investment more of a humanitarian return on investment, not the financial return on investment? Even though they'll make a gazillion dollars,
Mhm.
okay? They just wanna do it quickly, and that's the big problem. So I can list more celebrity billionaires that have not been here than I can that, no, I can there's less celebrity billionaires that haven't been here than there that have been here. I've had so many here, but I
Mm.
just refuse to accept their funding, especially when they insist on taking control and wanna get quick return on investments. So my focus now is just trying to reach out to the very discreet, ultra high net worth individuals that sit on their million acre properties, enjoying life, not in tune with everything else. Just they're falsely believing that somebody is working on a cure for aging and they don't have to be involved. And I am trying to make it known that if they want a cure for their diseases or their loved ones' diseases, those diseases aren't going to get cured unless they come out of the woodwork and start providing some financial support. And I'll tell you, I know people that can cure Alzheimer's. I know people that can cure pancreatic cancer. I know people that can cure a lot of viral diseases that people say they're incurable. Um, it's like, and I can cure aging, but it's not gonna get done without the funding and the control of the research. Okay, so the scientists have to be able to do the research that they know how to do without the investors redirecting them to do other things. And so that's my efforts right now. And it's really hard to find these people. And then when you find these people, it's very hard for them to turn their wealth into cash. And so those are the big struggles right now that I'm always faced with. And it just on and on. Yeah. So that's, I think the only solution is going to be that we got to find funding sources from people that are not obsessed with quick return on investments and are willing to, and they can monitor everything. They can make sure that every penny is going towards the research and not to buy the scientist some yacht or something like that. You know, and that's because the people I know, they don't want to do anything else except work in the lab. They want to go in the lab and cure diseases and things like that, including myself. And we just can't do it. Now, I get all my funding right now from go-to-market partners. Okay, so
Okay.
I have, and another solution besides the very discreet, ultra high net worth individuals is, doing research, you stumble upon cures for diseases and stuff like that. Now, we typically just put those on the shelf because they're not cures. They're ways of like slowing down the onset of diseases or things like that. we don't want to spend all the time doing clinical studies on something that by the time the clinical study is done, we're going to have something better. I'd
Mm,
rather focus on creating the things that are better. We allow so and only on request. Okay. I don't spend time going out searching for these go-to-market partners. When some go-to-market partner contacts me and says, "Do you have something that will do this or that or something like that?" And I say, "Yeah." Well, then I license it to them and they do the clinical studies, they do the marketing, they do the product development, large scale manufacturing, stuff like that. Well, I focus on my research.
okay.
But in doing so, I get a royalty from the sales of their products. I think the best one that's ever going to come along is something that hasn't been launched yet, but we now have a go-to-market partner that is creating a pet product, a product that will extend the lifespan of pets. So,
Okay.
there's a lot of profits to be made. And I have a feeling that when this product gets launched, it's going to be called Telo Dash, Telo dash DASH. Believe me, I'm a volunteer scientific advisor for a lot of these companies that have these really brilliant ideas, and I want to get some of the funding in their hands too. But yeah.
Do you think that these go-to funds are the way to go for founders in some of these smaller companies that are trying to find these new cures and new drugs?
Yeah, but they have to have the things that the other companies would market. I've made a list of like 25 different discoveries that we have made that that go-to-market partners could uh, uh, develop into products and make a lot of money. Quick return on investments. This is, well, I make this list available to people, but I don't actually go out and market it. Okay, but there are, and that's how this pet product came along. It's because
Okay.
somebody came to me and I said, "Yeah, well, we do have products that actually do extend the lifespan of dogs, cats, and horses." Yeah, but most of the people that have started the other company, most of the friends that I know that have started other companies, they don't have other things that they could market that somebody else could market for them, that kind of thing.
Okay.
Yeah, but that's also I believe I believe that that's what everybody should do. If I could just start all over again, I wouldn't have started my company with investors. I would have started a separate company and just make a lot of money for myself and then used my own money to invest into my research because believe me, we would have had aging cured 15 years ago if I had done that route. I spend too much time trying to find funding just to keep the operating expenses paid here in this company, let alone doing research. I mean, the the business plan that I have says that in order for us to cure aging, we're going to need $130 million and at least 3 years of research. And that's
Mm,
extrapolating from all the research we've already done. So we know what to do. It's going to take another 3 years and $130 million. And believe it or not, at that point, I believe we'll have aging cured and for real, not just some. I gauge my success for curing aging on something I call the Betty White test. I mean, I show pictures of Betty White when she was 85 and 25. And I wish she was still alive because I would have loved to have seen her walk out on stage and look 25, feel 25, and behave 25 again. But I still use those pictures because she was a friend of the family. I got permission from her to use these pictures before she passed away. But
okay.
that's how I gauge my success, and a lot of other companies are gauging their success by biomarkers. But biomarkers, they only correlate with aging, and reversing the biomarker doesn't mean you reversed aging, you just reversed the biomarker. So, it's like
Okay.
but we all know what aging is, and that's why we have to I just go with the Betty White test.
Okay. Now, Bill, since there's been a product out there that we know it extends the life of dogs, I guess, so to speak, are there any correlations in the science for humans? Are there elements that you're able to pull from one to the other? Talk a little
Yeah.
bit about that, or are they just not related at all?
They just require more clinical studies. I mean, there's products that will slow down aging, and there's products that eventually will reverse aging. So we have products right now that will slow down aging. And when I say products, I don't have any products, but we have ingredients that people could put into products like either nutraceuticals or pharmaceuticals, chemicals, anything, gene therapies, things like that that are available if somebody wants to go through the trouble of doing the clinical studies. But I just want to make these things better before my company actually spends all that money and time on clinical studies, only to have when we get them done, I think we'll learn a lot from them because we've only our research is only studied it in human or dog, cat, and horse cells grown in petri dishes. We have never actually provided that to an animal because essentially it would be illegal. Plus, we don't have permits and stuff like that to do animal research here at my company. We're just basic discovery research. So people have to get approval from the Center for Veterinary Medicine, the division of the FDA called the Center for Veterinary Medicine, CVM, to be able to do the studies. But that's underway and that's getting going. And, hopefully this product will be out really soon, but it has to get approval by the FDA and stuff before it can.
Okay.
But when the product gets out there, I think that's going to provide proof of concept. Okay. And then a lot of these very discreet, ultra high net worth individuals are going to be saying, hey, can we take that product? And I'm going to say, hey, no, but we can provide you with a human. Because even though dogs, cats, and horses do age by the same mechanisms as humans do, whereas rodents don't, the ways of regulating those things require different types of molecules. But at least they affect the same targets inside of cells. And I believe that the number one target is telomeres, okay? Finding ways to prevent telomere shortening that prevents the Hayflick limit. And I believe, and we've done a lot of research showing that not only does this Hayflick limit put a limit on our lifespan and health span, it also explains all the changes that we all see in all of us as we get older or longer lived. And this is an area of expertise that I've been doing 40, 50 years.